This is the video on spinal cord anatomy. The spinal cord is a long structure that lives inside the spine. There is a special opening in the bone that the cord travels through, known as the vertebral foramen. The bone protects the spinal cord from injury. The spine consists of vertebrae that stack on top of each other. They are divided into 5 sections: cervical, thoracic, lumbar, sacral, and coccygeal. There are 7 cervical vertebrae, 12 thoracic, 5 lumbar, 5 fused segments in the sacral, and 4 fused segments in the coccygeal. A vertebra has a base called a vertebral body. Attached to the body are 2 pedicles that splay outward. The transverse process attaches to the pedicles, one on each side. These processes are the attachment sites for the spinal muscles. Arching back toward midline are the lamina, which meet in the center by a spinous process. The spinal cord fills the vertebral foramen of the vertebra as it passes downward. The first 2 vertebrae in the cervical spine look quite a bit different than all the other vertebrae. The first cervical vertebra has no body. It is essentially a ring. There are 2 smooth areas called the occipital condyles. This is where the spine articulates with the occiput of the skull. C1 is also called the atlas. It holds up the head much like Atlas holds up the world. The second cervical vertebra has a finger-like projection upward called the dens. The dens extends upward to make contact with the ring of C1. C1 can rotate on the dens, giving us a significant amount of head rotation. When a person is hung, the hanging will break the C2 vertebra open, allowing the spinal cord to stretch and pull apart. This type of fracture can be seen in injuries other than hanging, but it is called the hangman's fracture nonetheless. The spinal cord itself changes along its length. This depends on the systems that the cord must control at that particular level. The cervical spinal cord looks different from the thoracic that looks different from the lumbar. The cervical spinal cord controls the shoulder girdle and the arms. Therefore, the ventral horn must be larger. The ventral horn has the lower motor neurons that the cortical motor strip connects to. Since there are numerous muscles to control in the arms and shoulders, it seems reasonable for the ventral horn to be large. The thoracic spinal cord controls the motor output to the ribs. This output is not as large, so the ventral horn is small in this region. The thoracic spine does control most of the sympathetic output to the body. These neurons lie in the lateral horn of the spinal cord. This picture shows the lateral horns used for sympathetic innervation. The lumbar spinal cord controls the pelvic girdle and the lower limbs. Thus, it requires output from numerous lower motor neurons in this area. The ventral horn in the lumbar spinal cord is enlarged to accommodate these neurons. This ends the video on spinal cord anatomy.